I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Heart disease remains the number one killer of women as well as men. Would you know if you were having a heart attack? This is the People's Pharmacy with Terry and Joe Graydon.
Signs of a heart attack can be somewhat different in women. Even health professionals might not recognize a woman's symptoms.
When it comes to heart disease, most cardiologists have focused on cholesterol, but normal cholesterol levels are no guarantee that you're home free. What else should they consider? Dr. Mark Menelicino has some ideas.
It's really about inflammation inside of the heart, not so much about cholesterol. Half the heart attacks happen in people with normal cholesterol.
Coming up on the People's Pharmacy, find out what you should know about women's heart health.
First, the news.
In the People's Pharmacy health headlines, a cup of blueberries a day could be a tasty way to combat metabolic syndrome. In this condition, extra fat in the abdomen makes the waist larger. Elevated blood pressure, high cholesterol, and insulin resistance also signal metabolic syndrome. This common problem is linked to a higher chance of cardiovascular complications. That's why scientists are excited about their study of more than 100 individuals with metabolic syndrome. These people took either freeze-dried blueberries or a purple placebo powder daily for 6 months. The dose was 26 grams of blueberry powder or 13 grams of blueberry powder plus 13 grams of placebo powder or 26 grams of placebo powder. The highest dose is equivalent to 1 cup of fresh blueberries. It contains 364 milligrams of anthocyanin, the purple pigment in the fruit. The treatment had no effect on insulin resistance or blood pressure, but people getting the high dose had better blood flow and higher HDL cholesterol values. Their blood vessels were more flexible. The authors suggest that this may be due to nitric oxide production from the anthocyanin. They conclude, the simple and attainable message to consume 1 cup of blueberries daily should be given to those aiming to improve their cardiovascular health.
For decades, Americans have been told that red meat is bad for the heart. They've been encouraged to substitute white meat instead. As a result, millions treat steaks and burgers as forbidden foods and embrace chicken and turkey instead. A new study challenges that wisdom. Scientists compared the effects of diets high or low in saturated fat among more than 100 healthy adults. Within each group, people followed a diet based on red meat, poultry, or plant protein for a month at a time. Their meals were provided to reduce the chance of straying off the prescribed regimen. Both red meat and white meat raised total cholesterol and LDL cholesterol more than plant protein. It didn't matter whether people got red or white meat if they were eating a high saturated fat diet. Their lipids were elevated compared to those following a low saturated fat diet. The authors conclude that their study did not provide evidence for choosing white over red meat to lower heart disease risk.
Proton pump inhibitors suppress the secretion of stomach acid. Drugs like esomeprazole, lansoprazole, and omeprazole have long been mainstays for treating heartburn and GERD. Initially, doctors thought these drugs had minimal side effects. The FDA considered PPIs so safe, it approved drugs like Prilosec, Prevacid, and Nexium for over-the-counter sale. More worrisome consequences have become apparent over the last several years. Now, a study from the Veterans Affairs Health System shows long-term use of such PPIs significantly increases the risk of premature death. The researchers examined the health records of more than 150,000 patients in the St. Louis VA health system. Many of these were older men with records that extended at least 10 years. They found that patients who started taking a PPI like omeprazole were 17% more likely to die during the following decade than those taking a different type of heartburn medicine, such as ranitidine. The results published in the BMJ showed that the excess deaths were mostly due to cardiovascular causes, cancers, kidney disease, and infections. The The authors conclude, because of the high prevalence of PPI use, the findings have public health implications and underscore the important message that PPIs should be used only when medically indicated and for the minimum duration necessary.
The Mediterranean diet has earned a reputation for promoting heart health. Now, a Harvard study suggests it can be good for the brain, especially for people with type 2 diabetes. Researchers collected information on eating habits, blood sugar control, and cognitive function from over 900 volunteers during the 2-year study. The dietary information was scored according to how closely it resembled a Mediterranean-style diet. People without diabetes had better memory scores when they followed a more Mediterranean diet. The real rewards were to people with type 2 diabetes. Those whose diets were most similar to Mediterranean standards had better cognitive function scores on a range of tests. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Heart disease remains our number one killer. That's true for women as well as men. But women don't always think about a heart attack as a reason behind their troubling symptoms. Delaying treatment can be deadly.
To get a personal account of what it's like to experience a heart attack, we turn to Robin Oliveira. She was a registered nurse specializing in critical care, cardiac care, and bone marrow transplant. She's currently a writer. Her essay describing her heart attack experience was published in the Wall Street Journal. It was titled, "I Had No Idea I Was Having a Heart Attack. For Women, Cardiac Arrests Are Unseen Killers."
Welcome to the People's Pharmacy, Robin Oliveira.
Oh, it's a pleasure to be here. Thank you for having me.
Robin, your article in the Wall Street Journal was absolutely amazing, starting off with saying it felt nothing like I'd imagined about a heart attack. Can you tell us what happened to you?
Well, yes, I was in a bar class and leaving the bar class when I suddenly felt as if I had incredible, intense, full body weakness, as if I were walking through mud. And I was surrounded by people I didn't know. And had I been surrounded by people I knew, I would have asked for help, but I didn't. And I sort of slowly walked to my car. And so after, I would say, about 5 minutes of that experience of full body weakness, in my car, I became extremely diaphoretic, which means a cold sweat, very short of breath. It felt as if someone had put their fist through my chest, but were pressing on my spine. So it didn't feel like crushing chest pain. It felt as if my spine were aching. And I had this immense throbbing in my arm, my left arm, right around my muscle. And frequently when you hear about left arm pain, they say radiating arm pain. So I had always imagined that it would be this pain that ran down in my arm into my hands, and that's not what it was. And I had been doing weights in a very intense workout, and I was pretty able to think what I was reaching for reasons for those symptoms that were ordinary, like I worked out too hard or some sort of thing. And then the symptoms subsided, and I called my husband and said, gosh, I think stopping that proton pump inhibitor, which is a medication for heartburn, was just too much because I'd stopped it about 3 days earlier. And I knew that you could get rebound heart pain. Again, I was reaching for an ordinary reason for an extraordinary symptom. And then I was able to drive home. And while I was on an overpass, getting onto a freeway, the symptoms returned, except they were worse. And my eyesight narrowed, and there was no place to pull over, and I just had to keep driving home. And when I just finally went up the hill to my house, it was probably a drive of about 4 miles, and I drove into my neighborhood, and there was my neighbor, a physician, and I told him I was in trouble, and I asked him to help me. And I drove home, and I parked my car, and I handed him the car keys, and he dialed 911 for me.
So he clearly recognized that you were, in fact, in big trouble. What happened? Who responded as the first responders, and what happened then?
The first responders were just firefighters. There's a fire station right up the road, and they came and they just talked to me through the window, and I was thrashing and very deep. I'd like to describe it as that it was so deep it was hard to surface. I was breathing really hard, couldn't think properly. And all they were saying through the window was, stop breathing so fast, slow down your breathing. And to my neighbor who was saying to them, it looks like she's having a heart attack. You need to treat her as if she's having a heart attack. You need to give her oxygen. They refused. By then, my husband came home. He'd been at the grocery store. He saw what was happening. He's also a physician. And he was saying, you have to do something for her. She's having a heart attack. And they ignored. And then the symptoms subsided, as often happens during a heart attack when it's just beginning. Sometimes the clot that is forming because plaque has ruptured eases a little bit because the clot isn't quite mature yet. And it flooded my heart muscle with oxygen. And they hauled me out of the car and talked to me for a long time. By now, the medics had arrived, the real certified medics. And they just said, well, since we're here, we might as well get an EKG. And they made me walk from the car to the van and climb into the van. And that's when everything erupted. It was worse. The symptoms were 5 times as worse. I was dripping with sweat. My skin, I'm told, was gray. I felt short of breath and incoherent. And when the medic put the leads on and he saw, you can tell on an EKG when someone is having a heart attack because the ST segment of the EKG signature lifts or comes up from the baseline, elevates. He panicked. He put in the 2 lines. He gave me oxygen. My neighbor showed up with some baby aspirin. They gave me morphine. And we raced to the hospital. And on the way, I broke into an irregular rhythm, atrial fibrillation, which from my old days as a nurse, cardiac care nurse, I knew probably meant that it was my right coronary artery that was obstructed. And they took me into the ER, and then everything happened fast. Chest x-ray, morphine, another EKG. They called in the team, and they wheeled me up to the unit where they put in the stent. And my husband showed up just before I left, and I told him I loved him. I told him to tell the children I loved him because I really thought this might be it, that I might be dying. They successfully placed the stent. I recovered quite well, and I went home and recovered quite well from the heart attack. And that's because I was within the 2-hour window of getting to the ER.
You know, it seems like the moral of this story is that here you were, a former cardiac care nurse, a health professional in your own right, your physician husband and the physician neighbor, and yet you were not treated initially as if you were having a heart attack and rushed instantly to the ER. And you didn't even recognize initially that you were having a heart attack. What's the message for all the rest of us who don't know what it's like, especially for women?
Well, I think there are 2 messages. The first one is, if something feels as if it's terribly wrong, it probably is wrong. And in my many years as a cardiac care nurse, I learned to pay very close attention to the patients who were coming down the hall on the gurney who were saying nothing was wrong, because they were often the ones who were the sickest. So if something feels unusual, if you've experienced nothing like this before, if you sort of have a sense that something's wrong, just call 911. And the second takeaway for me has always been that people, like I did, you tend to slink away. It's almost as if animals go and hide when they're very ill. I felt that same urge to get away from people and to go hide. So if you're with people who look as if they're a little gray, they might be clutching their chest or their arm, or they're short of breath, or they're sitting down and they go away, stay with them, insist on calling 911, because in the moment, no matter how educated you are, no matter how familiar you might think you are with the symptoms, you are not going to be able to process what is happening to you, because not only is your heart deprived of oxygen, but your brain is too, because your heart is unable to pump as well as it is, and your brain is operating at a lower oxygen level. It just makes judgment extremely difficult. And that, I think, is the thing I try to convince people to understand, to incorporate into their thinking, so that if it happens to others, they can be of help. And if it happens to themselves, they might be more likely to call 911.
Robin, we understand that sometimes the presentation of a heart attack in women is different from men. What danger signs should women really pay attention to?
Well, it can often depend on which artery in the heart is affected. But for women, nausea or indigestion is often a very strong indicator either of ischemia, an approaching heart attack, or of the heart attack itself. A very cold sweat. Women are far more likely to break into a cold sweat. Extreme shortness of breath, where you just can't catch your breath. Often it's back pain that is the problem. It can sometimes show up in the tooth or both hands, usually one arm. And that sensation is unlike any sensation you've had before. It's a throbbing, hot, as if someone had reached their hand into my upper arm and grabbed it, but it was a burning hand and it was squeezing my bone. These are the signals that women often misinterpret because it doesn't sound like or look like what we've seen on television and in movies where you clutch your chest and you keel over. Sometimes it's a process, and it goes in and out as the heart sort of, after the plaque has ruptured, the body comes to the defense of it tries to repair itself, and it does it in a maladaptive way so that a clot starts to form, which is ultimately going to obstruct the artery and cause a heart attack. So that wavers in and out, and that wavering in and out is also a symptom. And I think that we think, this can't possibly be real. This isn't what I think it is. It can't be that. It went away. It doesn't look like anything on television. Instead, we have to retrain our minds to think, could this be a heart attack? How badly do I feel? I might need to call 911.
Robin Oliveira, thank you so much for sharing your story with us on the People's Pharmacy today.
It was my pleasure. Thank you for allowing me to do so.
You've been listening to Robin Oliveira, a former registered nurse who specialized in critical care, cardiac care, and bone marrow transplant. She's now a writer whose most recent novel, Winter Sisters, has just been issued in paperback by Penguin Books, and her story about her heart attack was published in the Wall Street Journal.
And, Terry, I think the message is, if you feel bad, if you feel strange, call 911. And that's true for men as well as women. Sometimes men delay too. After the break, we'll consider why we've been neglecting women's hearts for so long.
What did the Women's Health Initiative teach us about how women's hormones affect their hearts?
When you measure cholesterol levels, which numbers are really useful?
Are there other markers that might help you evaluate women's heart health? What are they?
Inflammation appears to be an important factor in cardiac health regardless of sex. How do you determine inflammation?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. Kaya Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's Kaya Biotics.com. Use the discount code PEOPLE for $10 off your first purchase.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And And I'm Terry Graydon. If you would like to purchase a CD of this show or any other episode, you can call 800-732-2334. This is show number 1168. The number again, 800-732-2334. Or find it online at peoplespharmacy.com. You can also download the podcast from wherever you like to get your podcasts.
The People's Pharmacy is brought to you in part by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
We're talking today about women's heart health. Many women worry more about breast cancer or hip fractures than they do about cardiovascular risks. Yet heart attacks kill 5 times more women each year than breast cancer. What should women know about their heart health?
We turn now to Dr. Mark Menelacino. He's board certified in both internal medicine and integrative and holistic medicine. He incorporates functional medicine, nutrition, traditional Chinese, and Ayurvedic medicine in his practice. His book is Heart Solution for Women, a proven program to prevent and reverse heart disease.
Welcome to the People's Pharmacy, Dr. Mark Menelacino.
Thank you very much for having me.
Dr. Menelacino, let's get right to the heart of the matter, no pun intended. We've neglected women's hearts. Women are dying. We need a better solution. Those are your words. Why? Why do you think we have neglected women's hearts for so long, and why are so many women dying unnecessarily?
Well, it really surprised me when I saw the numbers and that there are more women dying of heart disease than all cancers combined. And heart disease is findable, preventable, and reversible. So there's just so much more that we can do, and we really need to focus on women's health in general. We've made some big mistakes in hormones and heart health, and I'm here to help change that.
Hormones. In what way have we made mistakes about hormones?
Well, I don't think we really know. We were giving horse estrogen to women for decades, and the Women's Health Initiative studies taught us that it really wasn't a good idea. They do increase cancer risk, heart attack risk, stroke risk, blood clot risk. But for some women, the right type of hormones in the right amounts that are personalized to them are actually markedly beneficial. So it's really this personalization of medicine that's really coming, not a one-size-fits-all.
Well, you know, a lot of women were shocked, dismayed, when they heard about the Women's Health Initiative results and the fact, or should I say the data that suggested the hormone replacement therapy they were using, Prempro or Premarin, as you say, horse hormones, not only didn't protect them from heart attacks and strokes, which is what they had been told, it actually increased their risk. So a lot of women lost faith in medicine at that point, and it's taken quite a few years to regain that trust.
And with a lot of things in medicine, it isn't always what you don't know. It's what you know that just ain't so, as Mark Twain says, that you've got to really know what you're doing and who you're doing it for. And so it's not a one-size-fits-all. And the hormone is probably the most difficult to get right. It just makes sense that you would use topical bioidentical hormones, the same that a woman makes for her body to help her heart, then give her an animal estrogen by mouth that the liver has to process. And there were a lot of women that were taken off of hormones or denied hormones that really may have benefited for heart protection and brain protection.
Well, Dr. Menelacino, we've been studying heart disease for a long time. How is women's heart disease different from the heart disease that people have been studying all this time?
That's a great question. And part of the problem is we haven't been studying heart disease right this whole time. So when you see your doctor, you get a total cholesterol. They break it down into the good part of the cholesterol, the bad part of the cholesterol, and triglycerides. It's 4 pieces of information. The cholesterol test I do has 27 different pieces of information. It's really about inflammation inside of the heart, not so much about cholesterol. Half the heart attacks happen in people with normal cholesterol. And we know that this is true, that the cholesterol number really is not the issue. It's these particles of cholesterol called the fractionated cholesterol. You have to look at the small sticky marbles and the big bouncy basketballs. And there's a particular small sticky marble called lipoprotein A that may be the most dangerous for women. And it's not treated by the cholesterol drugs. So I'm not an anti-drug person. I use the statin drugs in my practice, but there's a very narrow population that benefits from them. And the real issue is chronic illness versus acute care illness. When you have a heart attack, you want to be found, you want to be treated, and you want to never let it happen. And the tools that we have for women just are not as sophisticated and personalized as they are for men. And that's changing.
Why not?
Well, women are different. And, many clinical trials, as we were talking about pharmacology, most of the clinical trials are done on men. It's a set population that we then extrapolate the results to women. There's not been great women heart disease trials. So we have to extrapolate the trials for men and apply them to women. But women are different. Their anatomy is different. Their hormones are different. The chemistry is different. And the way that they respond, they react, and they manifest a heart attack, it may show up as anxiety or nervousness or heartburn, digestion issues. It won't be the classic elephant on the chest that a man comes to the emergency room with. If you and I both have chest pain and go to the emergency room, I'll get admitted and worked up for heart disease. You'll get sent home with anxiety medicine or heartburn medicine. That's what's happening in our world today, and it's got to change.
Let me go back to your point about testing, because I think, as you suggested, most people get tested for HDL cholesterol, the good stuff, purportedly, the bad stuff, LDL cholesterol, the total cholesterol, and then, as you pointed out, the triglycerides. But you said, how many other things do you test for? Over 20?
Yes, we do. The classic first inflammatory marker was C-reactive protein, but now there's 7 more that also inflect the information of what's going on inside that artery. And that's really what we want to know. You were mentioning the total cholesterol and the good HDL, the bad LDL. Well, here's the problem. Many women come in and they have a high total cholesterol, but their good cholesterol is high, so there's a ratio that was derived from one of the big clinical trials. And they'll say, yeah, it's high, but my ratio is good, so my doctor says I'm fine. So let's just step back. And if we have a woman who's completely out of shape, 400 pounds, eats fast food every day, sits on the couch, doesn't exercise, and she has the same ratio as a woman who is fastidious about her diet, that has no inflammation in her life, that exercises daily, how can those two women have the same risk? So I treat people, not ratios. And what I look for is as much information to learn about that person. It's a personalized precision approach to your health, not regressing you as a unique individual to the mean of a population. We try to make everybody the same to fit that bell-shaped curve. But when I go to the doctor, I want to be seen as unique, as do my patients.
You mentioned how people assess risk, and you mentioned ratios. The American College of Cardiology and the American Heart Association have come up with a risk calculator. And they've revised it recently, and it's supposed to be so much better. And yet we've run the risk calculator, and what we see is that for men over 64 and for women about the age of 67, they could be vegetarians, they could be underweight, they could be exercising every day, running half marathons, they could be doing everything right, and even have very good, quote-unquote, bad cholesterol numbers. Their LDL could be quite low, and they'd still be recommended to get a statin. That doesn't make much sense to us. What about you?
Well, there's a lot of energy about statins that they're really, really good for you or they're really, really bad for you, depending on who you ask. And I think the statin drugs do make sense for a very narrow group of population, and the population is men that have had heart disease or have had heart attacks. There does seem to be a beneficial outcome in preventing death if you take that drug for those people. The data for the rest of us is not very clear. It's 8.9% of everyone that takes a statin has a risk of diabetes. In that Women's Health Initiative trial, it was over 50% of women postmenopausal had a risk of diabetes taking the drug. So we've got to really look at the risk benefit and narrow this down to who really benefits. The reality for statin drugs, it's men with known heart disease that do benefit, not much of a bigger population beyond that. And the statistics are really kind of all over the place about what they show and what they don't show.
Dr. Menolicino, why is inflammation the main thing that you focus on when you're looking at heart disease?
Well, thank you for asking, and this is really my passion. When you twist your ankle and it gets all swollen and red and hurts, that's the pain, inflammation, acute response. That's good. But when that ankle nags and you have old age arthritis that hurts every day, that's what the problem is. It's the same thing in our arteries, is that an acute reaction is good medicine. It's a good response for the body. When it's chronic inflammation, that's when all the damage is done. You know, they found that even 18-year-olds on autopsy have some plaque. And we thought it was a plumbing problem. You just filled up the artery with plaque until there was one little spot left. You had another cheeseburger, and then you were done. No, even with small plaques, it's the inflammation, irritability in the artery that is really what drives the problem.
How would you know if you had irritable arteries, if you had inflammation? What tests would be appropriate in addition to that CRP, C-reactive protein test?
That's such a great question, because if you do a basic cholesterol test, you have no idea. Some doctors are adding the CRP. We do one called myeloperoxidase, plaque 2, SDMA, oxidized LDL, the lipoprotein A. We look at these other markers of the inflammatory process that are now being developed that are linked to the hidden inflammation. And these are the people that are the canaries in the coal mine. You could be having this inflammatory process and have no idea. What's fun is the natural doctors and the Chinese doctors figured this out years ago. So they look at the body, they listen to your story. You know, we forgot that medicine. We don't talk to people. The average interruption is 11 seconds for a doctor to interrupt their patient. My visit is an hour. I listen to my patients. I look at them. I look at their skin, look at their ruddiness in their neck, look for the ear crease, that's a sign of oxidative stress. Look for the little hump on the back of the neck, which is a diabetes marker. Look for little skin tags, which are triglyceride signs. Look at the nails for their absorption. Look at their tongue for their digestion. Look at their thyroid. We check all of these things physically, and a lot of times you can get really good ideas of who's inflamed and who's not.
Now, we've been writing about that ear crease for decades, but I think most doctors don't pay much attention to it. Why do you?
Well, it's actually been thousands of years. The Chinese doctors looked at that and they call it a sign of stagnation, which is a dampness, which is kind of our word for inflammation. So it was known thousands of years ago that it's linked to just bad things. And there were some pathology outcomes looking at sudden death, heart attack, and the ear crease. It doesn't mean everybody with it is in danger, but it's just one of these signs the body shows. I call it an oxidative stress marker. And when I test people, we actually have advanced tests that look at oxidation, inflammation. We see a really high correlation of that ear crease and these oxidative markers.
Now, I have to be honest with you. We actually put a picture of an earlobe crease in one of our early books. And so a lot of our listeners are going, well, where could I see that? How could I know? That book is unfortunately out of print. Can you describe what an earlobe crease looks like and what somebody should look in the mirror for to see if they've got this sign of oxidative stress?
Well, you know, we always have to be careful about Dr. Google, but I just did this the other day. I Googled ear crease and it popped up. It's a 45-degree angle in the earlobe, and it has to be on both ears. Some people have it on one, not the other. That seems not to be correlated as highly as having it on both. And it's funny because in my practice, I sit with people. I teach them all of this. Like, I really want you to be your own doctor. I'm just the guide. And so they'll call me and say, oh, you know, we had a dinner party and we all sat down and looked at our fingernails and our tongue and our ear crease. And someone will come see me, and guess what? Their inflammatory markers will be sky high.
Are there interventions from natural medicine and Chinese medicine that you find really helpful?
Well, you know, I love the idea that food is medicine, kitchen's your pharmacy, lifestyle's your physician. That's from Hippocrates 2,000 years ago, and it still is true. So really looking at what you put in your body and how you move your body and how you treat your body. It's really that simple. So supplements are supplemental. The problem with most supplements is that they're junk. If you go to your medicine cabinet and pull out your over-the-counter medicines or your vitamins, look at the inactive ingredients. There are so many fillers and binders and phthalates and artificial flavorings. It's amazing what people are putting in their body today. So I'm not a big fan of vitamins that you buy at the grocery store. I'm a big fan of nutrients that you get from a provider who knows what they're doing, that's vetted the right kind of supplements. But at the core, let food be your medicine. There's also no diet. I don't believe in diets because the first three letters are die. It's developing a personalized nutrition plan. What does your body do the best with? And that seems to be the hardest thing for most people to figure out.
Well, I think what you're talking about explains what has been an anomaly for a very long time. People who can have absolutely fabulous numbers. They may even be taking a statin, and their doctor pats them on the head and says, wow, this is so cool. You have a total cholesterol of 165. Your LDL is 70, and your HDL is 80. I mean, you're perfect. And then 2 years down the road, they have a heart attack, and they go, what? How could that happen? And what you're suggesting is there are a lot of other factors, including this inflammation. So eating, quote-unquote, healthy food, what does that mean?
Well, that's the mystery in America today, right? Is what should you eat? How should you eat? There's a big gluten craze that's going on, and the problem is the wheat that I grew up with is not the wheat that is there today. It was amber waves of grain with a short head. Now it's a short wheat with a long head. It's hybridized. So our food is changing, and the way that we're making food and the way that we're factory farming food may not be in our best interest. But really, when it comes down to it, it's clean air, clean water, clean food. You want to do your best for yourself and your kids especially to provide that clean food. So, if you're getting a super-duper gluten-free, hybridized processed pasta, are you really doing yourself a favor? Maybe not. But using clean berries that are free of pesticides, you're probably doing yourself a real favor. The Environmental Working Group, it's EWG.org, publishes each year the Clean 15 and Dirty Dozen. It's a great place to start. Just look at what are some of the clean foods that you can do. And there are some things that make a big difference. And the berries, the dairies, and the meats. That's berries, dairies, meats. That's where most of our bad food lies because it's so pesticide used, the antibiotics are used in the animals, and there's so many other toxins that are being spread by our food. So you don't have to be 100% vegan and organic. Do what feels right. But really try to eat clean for yourself and, more importantly, for your kids. And for sure, don't take any supplements or medications that have additive ingredients in them. Turn it over and look at the other ingredients.
You're listening to Dr. Mark Menelicino. His book is Heart Solution for Women, a proven program to prevent and reverse heart disease.
After the break, we'll find out how doctors can help women prevent heart disease.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This People's Pharmacy podcast is brought to you in part by Verisana.com.
Verisana Lab offers home health tests that allow you to monitor your hormones and health conditions. You can take control of the quantitative assessment of your health and learn about male and female hormone balance, the stress hormone cortisol, leaky gut, gluten intolerance, or your gut microbiome.
Take a more active role in tracking your health and take 20% off your first order of a mail-in testing opportunity with the discount code PEOPLE. That's uppercase PEOPLE. To learn more, go to Verisana.com. That's VERISANA.com.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. To purchase a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 1168. That number again, 800-732-2334, or online at peoplespharmacy.com. You can also download the free podcast from iTunes or from our web store. We invite you to consider writing a review.
The People's Pharmacy is brought to you in part by Kaya Biotics, probiotic products made in Germany from certified organic ingredients. KAYA Biotics.com.
How effective are the medicines doctors prescribe? Unlike evaluations in Consumer Reports for cars, washing machines, or dish detergent, drugs don't come with clear ratings. How do we know which medications are most effective for preventing or treating heart disease?
Our guest is Dr. Mark Menelicino. He's board certified in both internal medicine and integrative and holistic medicine. He incorporates functional medicine, nutrition, traditional Chinese and Ayurvedic medicine in his practice. His book is Heart Solution for Women, a proven program to prevent and reverse heart disease.
Dr. Menelicino, one of the things that I think is hardest for health professionals and patients to understand is something called the number needed to treat, the NNT. And it's important when it comes to making decisions about taking medications like statins. Can you help us understand this thing called the NNT?
Well, I'd love to. And one of the hardest things for me was statistics. I never really figured it out because there's so much information you can hide by using numbers. The problem with most clinical trials is that they report a risk reduction. It reduces your risk by 36%. Well, what does that really mean? So it really, the numbers you can really make deceiving. The number we use in clinical trials, as you mentioned, is the number needed to treat and the number needed to harm. So how many people do you have to treat to get one benefit? That's really what you want to know. If I treat 100 people, how many will benefit from it? And with the statin drugs, the number is abysmally low. It may be, and it depends on what population you're talking about. In men with known heart disease, there does seem to be a benefit of about 1 in 25. Not really great. In men with no heart disease, it's much, much higher. A European study looked at women under age 50. It's 1 in 5,000. The problem with the number needed to treat is that there's also a number needed to harm. I mean, really, all medications are essentially toxins that have one good side effect, and that's what we use it for its medical use. So there, you've got to weigh the good and bad sides of every medical decision. And so the number needed to harm is actually also played into that number needed to treat. But the number needed to treat for most medications is fairly high. You have to treat a lot of people to get one benefit. And that takes in then all the side effects, the cost. And so really, what are we really doing? And I think lifestyle medicine is the answer. If I may switch to diabetes meds, they did a study in Minnesota looking at the number one diabetes med versus lifestyle at a YMCA in a controlled clinical double-blind placebo-controlled trial, a state-of-the-art trial. They found lifestyle medicine beat the diabetes medicine. Well, I've known that for 25 years after working with Dean Ornish. He showed that you can reverse heart disease and not need a bypass surgery by eating right, exercising right, dealing with stress, and having love and support in your life. Better than a bypass surgery, so the data is there.
So when you say lifestyle medicine, you mean eating right and exercising and what else?
Well, it's really a combination, and Dean Ornish proved it. He did it with heart disease, now he's doing it with prostate cancer. That if you incorporate good food, you have good movement, you have good love and social support, and you find a time in the day to engage the autonomic nervous system, the parasympathetic relaxation system, you'll do better in almost every disease. It's been tried with cancer patients, with diabetes, with heart disease. And Dean Ornish picked the hardest target, men that had heart attacks, that had known 3-vessel blockages, scheduled for bypass. He talked them out of it and talked them how to eat right, exercise, deal with stress, and do group meetings, and they did better. And now 35 years later, guess what? His group is still doing better. So that's my message for me is I don't think that this is a good idea. The data is obvious. I worked with him in his group. I saw these people get better, and this is what we do on a daily basis. Yes, sometimes medicines are needed, but the lifestyle medicine trumps pharmaceutical medicine for chronic illness every time.
The word you used was taught. Dr. Dean Ornish taught his patients, and that's what you do in your practice. But most physicians have not been trained in how to coach, teach, encourage their patients to make the kinds of changes that you're talking about. And they often don't have the time because, as you mentioned, you have to take an hour. Well, most physicians have to be in and out of that exam room in anywhere from 7 to 12 minutes, which is not a lot of time. So if a doctor says, hey, Joe, you need to exercise more, you need to eat less, you need to, relax a little bit now and again, and I'll see you in 6 months, that hasn't helped me very much make those kinds of changes. So how do you begin to do that in your practice? How, in your book, do you help people make lifestyle medicine changes that can be lasting?
That's such a great point. And I believe in my heart that everybody wants to, that all the doctors would like to, but our system is not set up. It's set up to check your blood pressure and adjust your drug dose based on the blood pressure. And I think that that's a broken model for chronic illness. Now, if I have pneumonia and I need an antibiotic, I want that. The acute care medicine model is fantastic, but the chronic illness model is broken, and we need a better way. And there's a whole army of physicians coming, of health coaches, of nutritionists, and of patients. And, I really think the most empowered person on the planet is a supermom. It's a mom that wants better for herself, her kids, her partner, and she's going and getting this information. That's who this book is written for. It's really about the heart, but it's about a whole lifestyle of how you can address the thyroid, adrenal, gut, detoxification, hormone balance. Look at all of those things for yourself, because if those are balanced, at the end of the day, your heart's better. So it's really trying to put all of this together, and there's so much great information like the People's Pharmacy. All of this information coming out, people are becoming empowered to bring it to their physician. And I'm hopeful there's a whole new generation of physicians coming that are looking at nutrition because they grew up with nutrition and they're going to talk about it in their practice. So health coaches, nutritionists, there's a lot of these ancillary providers that are providing the tools to do it. And you're right, it's so hard for a doctor to do everything in today's medical world. But I think it's a choice. You have to decide you're going to make nutrition the focus of your practice or not. And if you do, people will flock to you.
When you mention adrenal glands, thyroid glands, other hormones, gut health, we're talking about a whole panoply of specialists that really don't interact with each other very much and, kind of look at just the one part of the body that they're interested in. How do we look at adrenal health and thyroid health with respect to heart health?
That's such a great problem that we have. And, we have so many specialists and ologists and silos that we really silo all of these problems into one area and one specialty. And I think that that's changing with the integrative functional medicine movement. We look at the whole person. And the adrenal is probably the most misunderstood. There's this term called adrenal fatigue, which I'm not supposed to say, or adrenal dysregulation. But the adrenal glandular autoimmune disease is called Addison's disease. That's what John F. Kennedy had. That's an autoimmune failure of the adrenal. But in our world, so many people are going Mach 3. There's super moms that have jobs and special needs kids and relationships, and they're super firing their adrenals, and they can't keep up. I like to think of a woman as this beautiful symphony. The pituitary gland is as big as your pinky nail and runs your whole body at the bottom of your brain. We're talking very small amounts of chemicals have amazing downstream effects. The pituitary is the conductor of this beautiful symphony of a woman. Her thyroid, the thyroid sister is the adrenal gland. They interact with your hormones, which change daily, weekly, monthly, and during your life. And they all are controlled by the gut metabolism. So it's thyroid, adrenal, hormone, gut. If you get those parts of the symphony in harmony, women do really, really well. And their heart disease risk is lower. Imagine that. So that's how I approach women in my practice. I see them as this beautiful symphony, help understand why it's out of balance, and bring harmony to those parts. And then good things happen for how they feel, how they digest, how their menstrual cycles are, how their mood is, their heart health, and their brain health.
When you say adrenal fatigue, a lot of your colleagues go, oh, what a kook. I didn't learn about adrenal fatigue in medical school. What the hell is he talking about?
Well, it's interesting because we were talking just yesterday at a conference about this cortisol steal, which is another mythical concept, but in sense, it makes sense. And I was at the Natural History Museum yesterday looking at Paleolithic man, and interesting, it was all Paleolithic man, no women. But we were talking about how the adrenal is queen, that your body doesn't care if you can reproduce if you can't run from the saber-toothed tiger. And that really dawned on me that that's true. So the adrenal really is the most important with cortisol, with adrenaline. And this adrenal fatigue idea is a colloquial term that's not very well understood. And a lot of doctors think of it as this autoimmune Addison's disease. But your adrenals fire all the time. We are in fight or flight mode in today's world all the time. And that's why you need to relax. That's why meditation works. That's why yoga works. But the adrenals, they'll be in this fight or flight, and they'll fire all day long. And we've all had those stressful times. And what happens for women is it takes their female hormones, particularly progesterone, and converts them to use into this adrenaline cycle. Because again, your body has to have adrenaline to fight the saber-toothed tiger. It doesn't need the reproductive hormones. And that's an interesting way to think about how this is all related. That, in medicine, we want the silos, that everything is kind of put in its own little silo. But I kind of step back and say, no, you're this beautiful, functioning symphony. How do we get all of the parts of the symphony in harmony? And that's how a woman wants to be looked at by her doctor. And that's the doctor of the future, someone who can bridge all of those. Yes, we'll need cardiology and pulmonology and endocrinology, but we need the doctor at the forefront that can understand this harmony.
Now, when we have women who are trying to improve their own health, where do they start?
Well, they start with their fork. I have heard Mark Hyman say you vote with your fork, and really it starts with that. In my practice, I talk about nutrition, and I've had nutritionists, and they do a long consult. But at the end of the day, I've got to make it easy for you. So when you come to see me, we'll talk about nutrition, all the benefits, but I'm not going to put you on a gluten-free, soy-free, dairy-free, casein-free, whey-free, corn-free, almond-free diet because you won't know what to eat.
You eat broccoli.
Yeah, well, and that's it probably. But we make nutrition too hard. I'll ask you, you know what? For the next 2 weeks, could you make a milkshake for breakfast and stop eating bread? Does that seem possible?
For 2 weeks? Sure.
Yeah, a milkshake? Wait a minute. That's not healthy.
Yeah. Well, it's a special kind of milkshake. It's a protein shake that has some digestive natural products in it to improve your digestion. It has some liver supports that help to improve the liver detoxification. But it's just it's a non-whey-based protein shake that you put a little coconut milk. You can even do the chocolate one and put in some peanut butter, almond butter, if that suits you. But it's a protein shake to get a good protein source in the morning. It fires all of the metabolism up. And when your body sees that as a clean meal, then you only have to fight over 2 more meals. And the rest of the day, all I need you to do is to not eat bread. Did you know that every slice of bread, even the 12-grain whole wheat bread, your body sees like a can of soda pop? The sugar load from a slice of bread is equal to a can of soda pop. That's my easy nutrition plan because I don't want you to go on a diet that you hate. I want you to develop a passion with food and find a way to love it. And one way to do that is to make 1 or 2 simple changes at work. Then women come back to see me 2 weeks. Their pants fit better, that sore knees a little bit better, just by doing this little task. And no one fails because we teach them how to make the shake. And it's a very simple, easy thing to do. It's a protein shake for breakfast. Then just avoid bread for the next 2 weeks until I see you back. Everybody's successful. They feel good because they've been positive. They've made a success. And a lot of times in this integrative medicine, we ask people to do too much. And like I mentioned, avoid casein, whey, dairy, corn, soy. It's too hard. Let's not make it hard. Let's make it easy, make it successful, and get you started.
Dr. Menalocino, what should a woman do the next time she sees her primary care physician, maybe her cardiologist, maybe her endocrinologist? What questions should be asked? What tests should be performed? And what should she ask of her health professional so that they can partner together to prevent heart disease and improve overall health?
Well, I think you hit it right on the spot, is that it's a partnership. And so first, I'm an internal medicine specialist. I talk with doctors. I work with doctors. I speak the doctor language, and you need to as well as a client. But this is really, number one, can you have a healing relationship with your doctor? If you can't, if he's someone who sits or she sits in the chair directing you, telling you what to do and talks at you, maybe you need a new doctor. But it's a partnership that you do. Ask them if they know about these new inflammatory markers, about lipoprotein A, and get tested for it. That's one of the big mistakes that we're doing, is we're not doing some of this advanced testing. And you don't need it every year. You just need to know if you are that canary and then figure it out.
Dr. Mark Menalocino, thank you so much for talking with us on the People's Pharmacy today.
It's my pleasure. Thank you for having me.
You've been listening to Dr. Mark Menalocino. He's board certified in both internal medicine and integrative and holistic medicine. He incorporates functional medicine, nutrition, traditional Chinese, and Ayurvedic medicine in his practice. His book is Heart Solution for Women, a proven program to prevent and reverse heart disease.
We spoke earlier with Robin Oliveira. She wrote about her heart attack experience in the Wall Street Journal. Her latest book, Winter Sisters, is just out from Penguin Press.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is brought to you in part by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
And in part by Kaya Biotics, probiotic products made in Germany from certified organic ingredients. That's KAYA Biotics.com.
If you would like to purchase a CD of today's show or any other People's Pharmacy episode, you can call 800-732-2334. Today's show is number 1168. That number again is 800-732-2334. You can also find it online at peoplespharmacy.com.
When you visit our site, you can share your thoughts about today's show. Do you have experience managing heart disease as a woman? What's working best for you?
And when you go to peoplespharmacy.com, you could sign up for our free online newsletter or subscribe to the free podcast of the show. That way, you don't ever need to miss another episode, and you can share it easily with a friend.
When you sign up for the newsletter, you'll get our free e-guide to favorite home remedies. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening, and please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.